when you're dealing with the overuse type injuries, that's the group, particularly when you get to the Olympics. They've been training their whole lives. You're going to want to do anything you can to kind of get them through the Olympics. So conservative treatment, they've got the best physiotherapists on hand there, anti-inflammatories, maybe an injection, anything you can to kind of get them through the games and competing at their highest level. Unfortunately, when you start talking about the more traumatic injuries, sometimes those aren't things that you can kind of play through. Shoulder dislocations, things like that, where if that happens, it's probably the end of the Olympics. And then oftentimes those are things that would probably more likely need surgery a little more quickly than some of the more overuse type injuries. The shoulder becomes a very complex joint to treat because unlike the hip, where it's very constrained, where it's really a ball and socket joint, the shoulder is much less constrained. It's basically a ball sitting almost on a saucer. And it's really the soft tissues around the shoulder, the rotator cuff, the labrum that play the main role in stabilizing the shoulder. And you need the shoulder to really have kind of full range of motion so that you can participate in sports at a high level, so that you can throw a baseball fast, so you can swim fast, so you can serve a volleyball or spike a volleyball hard. But if you lose that kind of perfect balance of these soft tissues, that's when it becomes a setup for injury. And treating these athletes becomes very difficult because there are so many sort of moving parts and soft tissues that are sort of working in concert. Things need to be sort of working perfectly for them to be able to function at the highest level.